Hi, I'm Dr. V from ACV Real Family Dental and Dental Associates in Farr and McAllen. In this video, we're going to be talking about deep cleanings or scaling and root planings. This is a really important concept in dentistry because the CDC states that about 47% of all Americans over 30 years old require a deep cleaning. That number actually goes up to 70% for any adults over 65. So there's a large portion of our community out there that may require a deep cleaning. Before we jump into what a deep cleaning is and why you may be a candidate, it's important to understand the 4 types of cleanings that a patient may receive. The first cleaning is the standard prophylaxis cleaning. This is the stereotypical insurance-free cleaning. A prophylaxis cleaning literally means a preventative cleaning. So this is a cleaning that is done when there are no disease processes present, when there's no inflammation present. Really what this means is if you've been doing a great job of brushing and flossing twice a day and everything is looking good, this is preventative to make sure that we don't ever develop a disease process. The second type of cleaning that we can receive possibly is a scaling in the presence of gingival inflammation. So this is an in-between type situation where when somebody can develop a little inflammation or gingivitis, a moderate scaling can be done to bring that patient back into a healthy state. The third possibility here is the deep cleaning or a scaling and root planing. A deep cleaning or scaling and root planing is done when there are disease processes that have been found or damage to the supporting structures such as the gingival tissues or the bone. The fourth possible cleaning that you can receive is called a periodontal maintenance. This is actually done after a deep cleaning, and this is done to ensure that anyone that has ever had a deep cleaning before in the past doesn't relapse and need that deep cleaning again. So those are the 4 types of possible cleanings. What's really important to understand here is that your hygienist and your dentist come together. They form a treatment team for you, and a diagnosis is made based on your specific needs. So if you come in and you have been brushing, you've been flossing, you've been very diligent about what is needed in regards to your oral health care, then most likely a regular 100% covered oral prophylaxis is going to be the recommendation. However, if there are some areas with inflammation, with bone loss, with gingival inflammation or unattached tissues, it may be possible that a deeper cleaning is recommended. Now, let me talk about how that diagnosis is made because that's a very important distinction. Most of the time, when you come into our office as a new patient, you're going to be subjected to some periodontal probings and some measurements provided by our hygienists and our doctors. This is done because the supporting structures have normalized within normal limit type values that need to be monitored. In most situations, the measurements that we take, measuring the pockets around your teeth, a physiologic response would be anywhere between a 1 and a 3 millimeter reading. When our hygienist or our doctor measures your periodontal pockets the first time that they're meeting you, any areas in your mouth where we identify a 4, 5, or 6 millimeter reading is indication that there is a disease process that is taking place. That can mean that either the gums are really nice and inflamed and angry. That could mean that there is bone loss in that area. This basically tells us that there is something that needs further investigation. When taken as a whole, and we're able to take a look at your entire chart, as we take a look and we see how many areas need further investigation, this is how we are able to identify whether a regular prophylaxis, a scaling in the presence of gingival inflammation, or a deep cleaning is required. Now, let's talk a little bit about the science and why this is important. you know, whenever we take a look and I'm meeting my patients for the first time, the most easy place to see calculus or calcified bacteria is just on the lingual of these mandibular anteriors. This is a trouble spot for all of humanity. The reason for that is we have salivary glands sitting just underneath our tongue. And all day, every time we eat or we drink any beverages, those salivary glands are just calcifying and bathing the back of those mandibular teeth. That calculus is a good indicator for what is happening underneath our gums. So something that I tell a lot of our patients is when you think of an iceberg that's floating in the ocean, this is a really important metaphor because we have that image in our mind of an iceberg that's floating. We can tell that there's a portion of that iceberg that's floating on top, but we know that icebergs have a portion that is sitting underneath the water. That's what's helping keep that iceberg afloat. This is very similar in our mouth. So when we see that large chunk of calculus that's sitting above the gingival tissues, it's safe to assume that there is a large portion of calculus that's continuing underneath the gums. That calculus helps disrupt the supporting structures, the ligaments, the gingival tissues, and the bone. Now, long term, this is a really, really important thing to note because the gums and the bone in our mouth are the most important thing that we have in our mouth. They're the supporting structures. This is this is very similar to the foundation underneath a home. In most cases, when patients end up needing dentures in the future, we're talking 70s, 80s, and 90s, most of the time it's not actually because we developed a lot of cavities or decay per se. Really, the underlying issues are infrequent visits to the dentist to get professional cleanings that address calcified bacteria underneath the gums. This causes weakening of the supporting structures and can cause those teeth to become mobile and to feel like they're moving a little bit. The other reason that this is really important is in middle age, it is really common to see teeth that begin fracturing when the foundation is weak. That's why we mentioned, and I specifically noted, that it's like the foundation underneath a home. If you think about a house that has weak foundation in one corner of that property, it's safe to assume that in that area, you're going to start to see cracks running on the walls. This also happens in dentistry. And so when that foundation, the gums, the bone, the ligaments are weak because there's a disease state process in place, we start to have fractured teeth, cracked tooth syndromes. This increases our likelihood that a root canal or a crown may be necessary or may be in your future. Lastly, I would like to address some just really common misconceptions, that I hear. And one of the most common things that I hear is, a patient will ask me, well, doc, I just want my free cleaning. I have my insurance. I don't want to have to pay for, a cleaning when you could just clean the top. Very similar analogy here is if you had a broken wrist and you went to the emergency room, would you tell that ER doctor, doc, that cast, my arm, I don't really want that. Just give me a Band-Aid. Let's put a Band-Aid over that broken wrist. Doesn't make sense. Similarly, if you had congestive heart failure, if your heart was failing you, would you tell your cardiologist, doc, I don't really want those blood thinners. Just give me a daily vitamin. And, periodontal disease is a disease process similar to the way heart disease is a process or diabetes is a process. The difference between these three things, though, is that periodontal disease is easily managed when working with your dental team. If you have any questions moving forward, I hope you reach out to us. Ask to talk to one of our dental management team. We look forward to hearing from you.